Hey everyone. Hey. It's Dr. Tess, Dr. Tess of Beverly Hills. Thank you so much for joining me on YouTube Live. I basically have a new service that we're starting, and basically is going beyond the Beverly Hills area. Let me just go as far as to say that. And let me pause for a second because there will be replay on this. I'm Dr. Tess of Beverly Hills, board certified physician and surgeon in private practice, Beverly Hills, California. On this channel, we primarily focus on the optimization of your aesthetic, hormonal, and physical health. To my subscribers, thank you, thank you, thank you. Thank you so much for subscribing to my channel. I sincerely appreciate your support. And for those of you who haven't subscribed, hopefully you'll see something that makes you want to subscribe as well. Today, we will be discussing the launch of the telemedicine platform being spread abroad to the 6 states that I'm licensed. Those states being Illinois, Indiana, Nevada, New York, Montana, and California. We also will be discussing some of the procedures that are available in our men's health and how people in the other states outside of California can take advantage of those procedures as well. Finally, we'll be talking about the topic of the direct pay insurance model, which we will have available. And I will explain to you the advantages of the direct pay. I always check to make sure the mic is on because one time I was like on here and I didn't have the mic on. But anyhow, we'll be discussing the advantages of direct pay over actually your insurance. So let's get into it. So we will go ahead and discuss the telemedicine platform first. Let me see, hold on a second. Welcome to live chat. Remember to guard your privacy. Yep. Okay. All right. So I guess the live chat is available. So if you guys want to, I think that you guys can go ahead and make a comment and I will see it on the sidebar. So the telemedicine platform that we will be using is a company called VSEE, literally V is in Victor, S is in Sam, E is in Edward, E is in Edward. So the way that you will go about setting up a telemedicine conference, let's say that you're out in the middle of the night or, wherever, or in your bedroom because you're not feeling well, you called in from work and you just want to talk to a doctor, or you have a cough, or your kids are sick, or whatever. And I pause, I am board certified family medicine, so I can see anywhere from neonatal to geriatric. I guess another way of looking at that is from the cradle to the crib. No, from the crib to the grave or something like that. Anyhow, you guys get it, from neonatal to geriatric. So either you're sick or your baby is sick or whatever. So you go into your Android or your iOS device and you just simply download the app VSEE, VC. Let me see if I have it downloaded here so that I could show you guys what the app looks like. All right. And I'm going to beat this horse to death. So there will be another version of this where I will do a shared screen. And that way I can pretty much show you guys how to sign up for it. But I just really wanted to go ahead and get this out. So I'm just basically doing it even without sharing the screen. Kind of quiet. Okay. I don't know why I just took that app off of my phone a little bit earlier. Oh, okay. All right. So I'm just going into the Apple store and I'm just, hey, how's it going? Could you puff up your cheeks? Oh, yeah. Well, you know what? I'm probably just not going to do that. All right. So let's see. VSEE. Okay. All right. So the app for that you would download if you wanted to get the telemedicine is, let me see if it's, how is it going to show on this screen? Okay. All right. Oh, let me see. Oh, I'm so dumb. I'm like sitting up showing it to the doggone. Okay. So there it is. Okay. All right. So you see the green V, right? So that's basically what the app will look like. So you download that app onto your phone. Once you get that app downloaded on the phone, you actually will follow the instructions and you can go into the clinic, and if the light is green, then that means that basically myself or another one of the providers, we're online and we're available to see patients. If there's no green light, if the lights are all red, you still can schedule an appointment. Once you schedule the appointment, we actually will get a indicator that will let us know that an appointment is scheduled. We check and we would reach out to you and then we would go ahead with the visit. Basically, that's it. Now, before the visit starts, you will have to make your payment. You will pay by credit card and you will have to sign a consent to say that you are okay with moving forward with the telehealth visit. You also will have to sign a waiver because the waiver basically will state that you are not going to go and try to get like have your insurance company pay and so on. So it just basically protects your insurance company, it protects you, and it protects us. Okay. So that's basically what we would do. So now the meetings are set up and they could be pre-discussed as far as how long you want to be on board on the platform, or we can schedule it at the time, like an urgent care, acute need issue, about 15 minutes. We do have meetings that are as long as an hour. And right now, the doctors that we have available for you guys to converse with, we have a pain management physician, trauma surgeon, a psychiatrist, and a internal medicine doctor. The other doctors that we will be getting on board will be GI, neurology, and cardiology. So now, as far as the payment plans and the bundles, we will have a link in the description below that will take you to the descriptor that will give you all of the details as far as the cost and the payment. All right, so that's pretty cool. And we are excited. This is a really big deal. We can send you e-prescriptions. Your note can be sent to your primary care doctor. Everything is HIPAA compliant. It is bank level encrypted, so it's not like somebody could just hack it and have all your business. This is a very serious situation, and we really went through a lot to give you guys the best because you're my patients and I love you guys. So that's number one. That's our telemedicine platform. So number two, with regards to our men's health, we currently have reduced rates and packages available for our men's health, the procedures that we have available, which include premature ejaculation, erectile dysfunction, impotence, sexual dysfunction, penile enlargement, and pretty much that's it. So, how we address each issue. The sexual dysfunction, you fill out a form once you schedule your appointment. And the sexual dysfunction could be caused by a lot of different things, a lot of variables, medication, situation, your partner, a health related issue, your hormones. We would weed through with the questionnaire. And then, if it is so determined based on the questionnaire, we'll go ahead and we'll get you in and we would try to resolve the issue. Some of the services that we have available on that platform would be injections, like, in your blood, injecting your blood simply. And also, well, it's variable and the costs are variable as well. So that's sexual dysfunction. Erectile dysfunction actually is a different issue than sexual dysfunction. A lot of times, erectile dysfunction possibly could be caused by a decrease of blood flow to that area. My preference is for the men to not cater towards medication like Viagra and Cialis. However, I'm also not a meanie weenie where I'm like, well, no, don't do this, because I want you to stay on board on my medical platform because at least I know you'll be safe. I will go ahead and we will try to determine the actual cause of the erectile dysfunction so that we can wean you off the medication and just basically cure the problem. Erectile dysfunction can be cured. If it's because of diabetes, we can fix that. If it's because of hypertension, we can fix that. The average blood vessel of a child shows signs of atherosclerosis. And you have to know that if your vessels are caking up as a baby, if you get 30, come on, seriously? I mean, like, we have basically started the downward slope. If no one is talking to you guys and making this all make sense, how would you even take these things into consideration? So that's the reason why I would prefer you come to me. I understand I'm on your side. This is confidential. This is not anything for anyone to be embarrassed about, because embarrassment or feeling uncomfortable could lead you to make a decision which could cause harm to you. And that's the last thing that I want to happen. Okay. So that's erectile dysfunction. We basically will determine the cause, address the cause, and resolve the problem. Done. Okay. Now, premature ejaculation. A lot of times, once again, premature ejaculation is secondary to the vasculature, or it could be an inanimate situation that you were not even aware of. As mentioned earlier, we do have urologists on board. That if there is something that I feel needs to be addressed by a urologist or a specialist, we will refer. I will not hold on to you or try to treat something which is beyond my scope. And that's also the main reassurance I want to give you. I'm practicing medicine amongst a team, not amongst myself, because do no harm. We all have to keep that in mind. Now, for the big elephant in the room, the penile enlargement. Basically, the skin of the penis has so much elasticity. It's incredible. Okay. And normally it's basically just kind of it's done with filler, and it basically is placed in very purposeful areas, because if it is injected incorrectly, it can go to the wrong area. So I would not get this procedure done by someone who does not have experience. Absolutely not. Once we get that procedure performed, it provides you with both length and girth. Okay. Now, as far as the costs do vary. They can run. It all depends. Like, there could be costs. I think the highest that a gentleman has paid has been like 10,000. Okay. And then we have lesser expensive. So it all depends on what outcome it is that you're looking for. Now, like, let's say you get the procedure done. You're like, you know what? I wouldn't mind getting a little bit big. Come on back. It's not a problem. Now, if you came to California, we would absorb that cost into your visit. Okay. So, like, if you were using Care Credit, we would include your airfare and your hotel. And basically, there's a hotel right next door to my office. We would have a corporate rate. I would have a car service, pick you up from the airport, take you to my office. You get set up, and I meet you over next door for dinner. We have the pre-evaluation the next morning. You get the procedure done, or if you come in early enough, you get the procedure done that same day. Actually, you can make it a roundabout. You can go back home. I would prefer that you stay overnight at least, so I could just check and see how you feel the next morning. We're done, 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 done. As far as your follow up, we would do it by telemedicine. You don't have to be here for your follow up. I will continue to monitor you. Let's say that you wanted a touch up, we get you back down here, not a problem. As mentioned, I don't have any problem going to the States based on the volume of patients. Let's see. I think that that's pretty much all that I can think of on that topic. If you guys had any specific questions, feel free to hit me in the, well, I don't know about the comment, but in the DM. But you guys could hit me because this is more so, personal. So I probably would say just go ahead and call the office 310-275-8377, 310-275-8377. Go ahead and give a phone call to the office. And I think that's about it. It lasts. It can last as long as a year to a year and a half. However, we do have multiple options set up to reduce the pain associated with payment. For example, a referral, you get credit for that. That will reduce your rate. Repeat business. If you come back to me, of course, you get a reduced rate for that. So I guess I would have to go as far as to say that I more so want you guys to be happy and enjoy your life and have whatever you want if you're medically appropriate, as opposed to not. So that's the main reason I'm offering this service to you. The third topic is direct pay. As I was stating earlier in Facebook, basically, insurance is not what you think it is. We just basically have been programmed to believe that it's the thing that we're supposed to do. Now, let's say that your deductible is $6,000, okay? And then your copay is what, $20 every time you go to the doctor, okay? So that means that technically, and you probably don't go to the doctor that often, maybe annually for your annual examinations. So you're basically paying $6,000 almost or more for a annual examination. And what are you really getting? You're delayed as far as your appointment. When you get there, you got cough, cough, cold, cold. Okay. You're in and out of that office so quick, you don't even realize that you were even seen by a doctor. And on that note, are you really being still at this point seen by a doctor? Because I do know that a lot of physicians are having their extenders to see patients with insurance, which is fine. It's a lot of brilliant extenders. I'm not taking away from that. But I'm just saying that I know that some people are just like my preference as an MD, even though there are some extenders, I want to make sure that I show respect and love to everybody. I'm not on here trying to say anything negative. I'm just giving substantiation to your decision if you did decide to go with our direct pay model. So with our direct pay model, based on your based on your circumstances or whatever it is, I was going to say pre-existing conditions, but I don't even really care about that. We have 3 tracks. One is the libido track, one is the looks, and the other is the life. Okay. So basically, let's say you go down the libido track. Oh, as far as men's health, I forgot to also mention that we do hormones, testosterone deficiency, and any other hormonal deficiencies you may have. So we go down the libido track. Okay. So that means that you pay your monthly membership fee. And I actually take into consideration a credit towards a hormonal product. And once you accumulate a certain amount of credits, I call you. I say, hey, you have your credit where you get your testosterone or whatever for free. So I'm just basically trying to build value in this relationship from your perspective as well. So you're like, look, I get in same day appointments. We have telemedicine. Some of the appointments may last as long as 45 minutes. My medication is covered. And every 6 months, she's giving me something for free. And that's just because we just really want to practice medicine. We don't want to deal with the back and forth in the games of the insurance company. That's not what we signed up for. We signed up to be your doctor, and I contribute my success as far as my practice transcending to this point. A lot of my colleagues and mainly Dr. Pickney, one of the doctors out of Dallas, who has mastered this format and he's doing exceptionally well. And so he has basically been mainstream as far as helping me get our platform all organized. So Dr. Pickney, I have sincere gratitude because he helped me to envelope this and get it ready to be distributed to you guys. As far as the children, as stated, it's a reduced rate for kids, and that includes their back to school visits, their vaccinations. Little Bobby fell and bumped his knee when he was on the monkey bars. Bring him in. If you are out of state, unfortunately, if you're out of state, we will have to have a second doctor because you have to have a primary care doctor. So you would have like me and your other doctor. However, I would have a relationship with that doctor. I would reach out to that doctor. Okay. And I would make sure that you were aware that I tried to get in touch with that doctor. If someone's in California and if they're in Southern Cal, they would be more than welcome to have me as a representation for that primary care arm. And that's about it. So, I'm looking forward to all these things taking off, panning out, and it's going to be an amazing year. I'm going to go ahead and post the sign up and the price sheets and everything. I'll post them in the different groups on Facebook. I'll leave links below in the YouTube platform that we're speaking on right now, and that's about it. So if no one has any, thank you very much for joining. So if no one has any questions or any concerns, we'll go ahead and we'll shut it down. I was going to say keep it brief, but I just looked over 21 minutes. What's brief about 21 minutes? Okay. Well, it's Dr. Tess. And join me. I will be posting another YouTube video. As a matter of fact, I will be posting it right after we get off tonight. And it actually is on penile papules. I figure we'll just go ahead and stay on penis stuff until the year runs out. May as well, right? All right. Well, if you have any comments or concerns, or if you have any questions, feel free to leave your comment in the comment section below. Don't forget to subscribe, like, share, tell your friends. Dr. Tess of Beverly Hills. Stay healthy. Libido looks in life.